Thank you. Welcome all our Maharashtra Ophthalmological Society esteemed members, and especially we welcome our presenters who are going to be part of the MOSCON Kolhapur competitive sessions in the form of free papers, video competitions, poster competitions, photo essays, PG thesis, so on and so forth. For this unique webinar come workshop, which is targeted towards all of you to help you learn from some of the best, uh, let's say, from some of the best experts in this field who have won multiple national and international awards for their research work in the form of best free paper awards, video awards, also best poster awards. So we have a galaxy of speakers who are going to take you through to make you understand how you can be a winner when you actually enter through this competitive sessions for MOSCON Kolhapur. And we also have amazing panelists with us. We are going to get to know all of them individually. But before we do that, I would like to introduce my co-host, Dr. Aditi Vatve. She is the secretary of Maharashtra Ophthalmological Society's Scientific Committee Wing. She is a very dynamic and sincere worker. She has contributed a lot in this year as the secretary of MOS Scientific Committee. She is herself a super specialty trained oculoplasty surgeon from LV Prasad Eye Institute, has been an alumnus of Arvind Eye Hospital, and she is going to be co-hosting this session today along with me. I would like to welcome specially our chairman of today's session, our president, Dr. Santosh Bhide sir, who has been a great support and guide for all of us throughout this year. Uh, Sir has had started a lot of new initiatives in this year, has worked very sincerely to take Maharashtra Ophthalmological Society at greater heights, and has been never, I mean, definitely he has been the backbone and the great support, a great guide for all of us at MOS. So, sir is a very well-known cataract and anterior segment surgeon from Pune. He has been a past treasurer of also Maharashtra Ophthalmological Society and the current honorable president of our MOS. I would like to invite Dr. Santosh Bhide sir to give his welcome address. Over to you, sir.
Uh, Thank you, Vardhaman. Good evening, everybody. And in the beginning, I would like to congratulate Scientific Committee, Chairman Scientific Committee Vardhaman, and Secretary Dr. Aditi for this innovative concept of conducting a webinar for those who are going to participate in MOSCON so that they are well prepared and they have a chance of winning. And I would like to congratulate the selection of the speakers also. We have renowned speakers from Maharashtra Ophthalmological Society, who we all know that they have won many awards, especially in free paper session. Dr. Parikshit has, I think, represented Maharashtra in Colonel Rangachari finals. He has gone, I think, 4 or 5 times. Dr. Akshay Nair is also another brilliant presenter, and we all know Deepak Meghur. His YouTube channel is world famous. His videos are excellent. They're very innovative, as well as there is a lot of take-home message in those videos. So great selection of speakers. And I would like to say only 2 things. Winning is not everything. Uh, wanting to win is something which is very important. And winning is not going ahead of others, but winning is going ahead of yourself. So whatever you have done, maybe last year, you have to improve next time and keep on improving. So you have to keep on winning every day by comparing to yourself. So I wish all the best to the participants of MOSCON for better preparation for their free papers, videos, as well as e-posters and photo essays. And I think without wasting time, over to you, Dr. Vardhaman and Aditi. You please introduce our speakers and let's start with this very interesting session. Over to you.
Thank you, sir. So as sir said, actually the main purpose of today's webinar was to make sure that all our presenters they put the best foot forward, and the quality of their presentations, of course, should improve. They should have a winning spirit. and at the same time, the quality of our competitive sessions, which is probably the core of our MOSCON, also will improve in turn. So we were very happy. Thank you so much, Dr. Bide sir, for your pearls of wisdom. I would like to invite Dr. Aditi to introduce our expert panel, please.
Good evening all, and once again a warm welcome from Scientific Committee MOS in the webinar with a slight difference and something which we are trying to elevate our level of the presentations. So we have esteemed panelists for our webinar. First is Dr. Anagha Herur, who is our Dynamic Honorary Secretary, MOS. She's the Managing Director of Anilai Hospitals, which is there in Dombivli, Thane, in that area with multiple other centers. She is also a member of ARC, AIOS, West, representing the West Zone. Our second panelist is Dr. Vivek Motevar, who is our MOS treasurer, currently is experienced ophthalmologist and currently working at Motevar Netralaya in Nanded. Our next panelist is Dr. Santosh Agarwal, who is our first vice president, now actually incoming president of MOS. He's trained at Shankar Netralaya, Chennai, and is a renowned VR and phaco surgeon from Aurangabad. And our fourth expert panelist is Dr. Mandar Paranspe. He is a comprehensive ophthalmologist practicing in Pune. He is current honorary president of Pune Ophthalmological Society and current joint treasurer of MOS. So I would like to welcome all the expert panels, and over to you, Vardhaman, for introducing our speakers.
Thank you so much, Aditi. So now we will be starting with our session. And first, we have none other than Dr. Parikshit Gopte sir. Dr. Parikshit Gopte sir is, as we all know, he has been the past chairman scientific committee of Maharashtra Ophthalmological Society. He has also been the past president of Maharashtra Ophthalmological Society, where he has done a lot of path-breaking work, including the constitutional reforms that he had conducted. He has been the scientific committee member of also prestigious All India Ophthalmic Society for 2 terms. And Dr. Gopte sir has a huge number of publications. I'm sure they run more than 150 in numbers. And most importantly, and recently, he has been inducted as one of the top 2 percentile researchers by Stanford Universities in the specialty of ophthalmology in the world. So that is a great honor for MOS. And it is very interesting. I mean, of course, sir has won many best paper awards nationally and internationally, but he has probably had one of the record break spells when it comes to as a finalist of Colonel Rangachari. He has probably been a finalist probably 7 times. If I mean, I think I'm right, sir. It has been almost 7, 8 times.
10 times.
10 times.
10
Wow.
times runner-up without this. So,
but sir has been a finalist for Rangachari for 10 times. So of course, we all are looking forward to learn from sir how to basically do a proper research and present the best kind of paper so that you have a chance to win the best paper award. Over to you, sir.
Thank you, Dr. Vardhaman. Thank you for the kind introduction and the invite. Can I share my screen?
Sure, sir.
Are you able to see my screen, ma'am?
Yes, sir.
Yeah, so at the outset, I would like to thank the President, Dr. Bide, Chairman Scientific Committee, Dr. Vardhaman, Dr. Aditi, Dr. Vivek, and of course, Dr. Anagha Herur, the Secretary, for inviting me over here. This is something which is very close to my heart, because I have always believed that free papers perhaps form the core of a meeting. We have a lot of invited sessions where we get to learn from the stalwarts in the field, but it is the submitted sessions from where we get to see the young talent, and from where many a times something new comes up, something that is completely new and out of the box. So free papers have their own, I will not say just charm, they have their own importance. And of course, I have, thanks to Dr. Vardhaman and the team, 2 more people, Dr. Deepak Megur, who is like fantastic in videos, and Dr. Akshay Nair, who is perhaps the youngest of the very well-known researchers in this country. So it's good to be in such august company. So, well, first is why submit a free paper? Well, that way posters are free of podium presence, so they are good for the stage side. Videos are better of showing off, or if you just want to show things well. E-posters are simpler. But then we have to understand that when we are submitting a free paper, scientific writing is different from journalism. Because we are not just healers or fixers of broken bones or ancient eyes, but we are also men and women of science. And it is when we are actually telling people the science that we have seen and we have done, we are doing ourselves and our fraternity a great, what shall we say, a great service. So normally in any, and I'm sure Dr. Aditi and Dr. Vardhaman will tell you in the end how the free papers are scored, but generally there are 4 criteria on which the selection or the scoring is done. One is it novel? Is it new? And of course, something that is new, completely out of the box, obviously grabs immediate attention. But equally important is it relevant? Is it significant? I mean, if we have Dr. Akshay, who has done some phenomenal work and he has found some new, melanoma, or he has done some excision, and I am somebody who is presenting simply on the various ways to reduce phaco power, then as far as lay ophthalmologists are concerned, the cataract surgery is more relevant to them than something which is very esoteric, which is like a rare cancer. So something that is relevant will fetch you definitely more marks. Is it scientific? When we say, is it scientific, means, is it valid? Because many a times people just present a single case report or a small case series. But if we really want to make an impact, then of course we have to have things like a randomized controlled trials or meta-analysis or something that has at least a longer follow-up. So, how valid it is. How, if we are presenting something, how really, it means what it is being shown. And then finally, of course, and this is where we will get a lot of this, and I think the younger generation is very, very good at it, has it been presented well? So the presentation, how you are understanding it, the colors, the graphics, whether it's eye-catching, whether it is attractive, because even that is very important. So all 4 of this then go on to make perhaps an award-winning PPT. So, but the first and the most important thing that I think young presenter should learn is time. Time is stick to it. Because in many places, if you overshoot the time, you are debarred from a competitive session. So it makes no sense that we have, put in so much of effort and energy into it. And just because we overshot the time, we are debarred of it. So see to it that you finish at least 15 to 20 seconds earlier. But at the same time, make the most out of your time. So if we have been given 6 minutes, yes, make it 5 minutes, 50 seconds. Just don't stop in 4 minutes. Try to make as much of it as possible. Well, there should be a clear flow so that at the end of it, people understand what the message is. There should be less material on a slide, or you can have a photo and a text. We'll come to it. And you need not read everything. And some things which you just want to show, you can use a subtext. So you have to choose relevant topics, avoid dull things. It has to be well prepared. It has to be thorough, because it's not just the judges. There will be your peers, your teachers, and yes, your competitors who will be sitting in the hall, and any and all of them can ask you a question. There has to be a logical flow of content. And whenever we are quoting something, then it has to be a legitimate source of infection, textbooks, published literature, and that has to be mentioned or cited. So I think perhaps that's not to be done in a scientific presentations. And again, as I said earlier, have less number of bullet points. It should be to the point. All the fonts and alignments must be uniform. And don't use too big ones. Choose a good professional template with subtle muted colors. And a lot of people use a lot of animations, transitions, and stuff like that. Many a times they actually distract us from what is the main presentation is. So make it as interactive as possible. Explain the important points in details. But the most important thing is you should conclude with a carry home message. People should understand, if we have heard something for 6 minutes, what is it that the message was? Because if they understand it, that is the prize winning, or that's the best thing that can be done, because what you have done has now been understood by your peers and others. So whenever we are making a scientific presentations, these are the big 5 W's which must be answered. Why are we doing it? The rationale. What have we done? Which is the method section. Where has it been done? When has it been done? And whom, by whom, on whom, the investigator, the subject population, your institution, your co-investigators, all of that should be there. But again, it's the science part that is most important. Because if you have a properly conducted scientific inquiry, you will always have publishers. But a flawed study, even if it is well dressed and there is a lot of gizmos and the presentation is perfect, well, it will still not perhaps put you on the podium, because an excellent icing cannot always disguise a half-baked cake. So finally, we do it. Perhaps as PGs, we have to do it because we have to give the exam. And nowadays, they don't allow you to fill a form unless you have had 2 podium presences. But in the long run, we owe it to our patients, our co-workers, and our fraternity that results of a novel observation or a study are reported. So this is usually how a scientific paper is written, the IMRD format, the introduction, the methods, the results, and the discussion. Even in the free paper, it can go on in a similar way, though of course you need not have similar titles. So the title has to be very catchy, it has to be informative, because that is something which will immediately grab people's attention. So we had done a study comparing phaco and SICS many years ago, which was published and which was presented in the American Academy. So we had put a simple title to it: why do phacoemulsification? Because doing manual small incision is equally effective. And then, of course, we had gone on, and there were almost 3 randomized control trials which were, published over the years. So it should be a catchy title. Ideally, everybody who has contributed along with you. So it will be your PG teachers, your co-workers, your boss. In case you're planning to join another institute, perhaps your next boss, so that at least they know that their name has been put over here. Or many a times an influential surname, because people think that, that may carry more weight. Well, with good MOSCON judges, it may not, but then you can never be sure. So try to have everyone who has contributed on it. It just makes things better. And this is when you start is, why is it important? Why is it worth doing it in the first place? So if you're, say, making a series of, say, 10 patients of mucormycosis, why is it important? Why you want to do this? And again, you defend the model, why it has been done. Again, for methods, this is the most important part of the paper. What is the method is what is going to decide how good your study is. So see to it that when you are planning the study itself, the method section is very, very well done. Because then there's nothing much that we can do later. And nowadays, in the method section, we have to have a few words on ethical considerations, where you have taken the ethics committee permission, because that is, it's a must nowadays. And again, the type of the study. So like we had once done a study, this was there in the last 2022 Rangachari, in which we had screened almost 46,000 people going from door to door, looking at their vision. So there were trained community health workers who measured the vision using a Snellen's chart. And if somebody failed on it, then they were referred to the vision center, where an optometrist did a refraction. But if the optometrist also couldn't improve them beyond 612, then an ophthalmologist saw it. And if the person did not come to the vision center, our team actually went to their homes. So perhaps in a single slide, you have shown what was done. Again, in the results, see to it that most of them are presented as tables or graphs. But even when you are doing that, you point out a relevant observation. Like in our study of 400 patients of phaco, there was only one nucleus drop. So yes, you can bury that in your huge data, but that is a very significant observation. So ideally, you should, present it. Also, there are many studies which are questionnaire based. So we have to give a context, the question that was used to get this answer, because the answer may change if the question slightly changes. And of course, analyze your data. Like this is a study we had done in tea workers in Assam, most of them women, in which we have given them presbyopic specs to find how much their tea picking increased. Now, in Assam, it rains heavily. It is one of the rainiest places in the world between June to September. And the tea bushes grow so much that how much you can pick depends upon how good you are picking the two leaves and a bud. Because if you pick or pluck more, then you have taken away the bud completely and the next bud will not come. So anybody who has delicate fingers and is diligent can pick a lot. And we found that if we gave them a simple reading glass, their daily mean weight of tea picked increased by 5.25 kilograms. That was huge as compared to people who were not given those specs. And it led to a 22% increase in plucking. And the tea gardens, they have a sliding scale. So if you pluck a lot, you get incentive. So their income actually increased by 30% just by wearing a reading specs. The same number of tea pluckers who are doing this for last 20 years. So again, when we use the regression model and we adjusted for the main outcome, if you are in the intervention group, you have the specs, your productivity increases. If you are a woman, your productivity increases. If you are given specs and you're actually wearing specs, your productivity increases. And this is a no-brainer. If you attend your work, obviously your productivity increases. If you take specs and you sleep at home, your productivity does not increase. So when we are making a result, do not present the same data twice. This is something we all do during our dissertation. The same data, male versus female, there will be a table, there will be a pie chart, there will be a bar graph. Yes, we want to pad up our dissertation to make it 100 or 150 pages. But that's not the case for a free paper where we have only 6 minutes. So here you don't include raw data. You don't discuss it over here. You number figures and tables consecutively, properly titled. So like we had used this LV Prasad's vision function questionnaire to look at what is the improvement in vision in blind children or schools for the blind children who are given low vision aids. Now here we found that if somebody's vision is say 1/60, we give them low vision aids, it becomes 3/60 or 2/60. As far as the logMAR visual acuity is concerned, there is no great difference. If you look at the WHO categories, there is no great difference. But if we use the vision function questionnaires for distant vision, do you have difficulty in reading the bus numbers? If the this is 2, the higher the score, the more the problem they have. Post is only 1. Or looking at the bus destination or reading your textbook at arm's length, there is a huge amount of difference. They are benefiting. Similarly, we asked it for near vision tasks. So do you have any difficulty in threading a needle? The difficulty is reducing when they are giving magnifiers. Do you have any difficulty in distinguishing between 1 rupee and 2 rupee coins? Again, so here, if we are saying something, we have to give the context. And once you have presented the results, then is you discuss the study. Like this, our study of that 46,000 door-to-door thing. Here, generally they say that increasing age, women, illiterate, smokers, alcoholics, they generally access eye care less. In urban slums, poor give less priority to health. And when we had looked at the barriers to cataract surgery, they are A, B, C, D. A, awareness, they are not aware of it. B, there is bad service. The local, perhaps, general hospital has botched up a case and nobody wants to go there. Or people can't afford to pay a private practitioner close by. Or there is no practitioner nearby. It's just far away. Now, ideally, when we had set up a vision center, A, B, C, D, all are taken care of. We made them aware, well, our service is decently good. The cost is very less. It was practically free. And the center is within a kilometer of their this. But in spite of this, about 200 people did not undergo cataract surgery, even though they were told and they were offered a free cataract surgery. So perhaps other than this, there is perhaps some psychological or social barrier that is stopping people from accessing surgery. So this is something new that had come out. So we always say that primary, secondary, and tertiary eye care are linked together. And if we have healthy eyes, it gives better vision and happier lives. But in spite of that, in this population, there were almost 100 odd people who were refusing to have this intervention, even though it was offered completely free of cost. So this is food for thought, and we have to perhaps do another study, a qualitative study, to find out why that's the case. And finally, you must always keep a slide on limitations of the study. So all studies have some limitations. Some have a shorter follow-up, some have lots to follow up, or you are not able to record everything, or there is an inter-observer variation. So if that is presented right during the presentation itself, it stops so many questions that would have come from the judges or your peers or from your audience. So like Dr. Bide sir said, it is not the winning, it is the presenting that is most important. Yes, it is. And in presenting, perhaps the most important thing, and which is why a good presentation should be something that conveys a correct and a clear meaning to the audience. I think if we have done that, I think we've won the battle. So thank you. Thank you for giving me this chance.
Very good.
Thank you so much, sir. I think this was amazing presentation. I'm sure that all our delegates have learned a lot. And I think there were three important takeaway points I would like to discuss. One was basically, of course, the selection of very simple but high impact topics. I think your study about those presbyopic glasses in those tea farms in Assam has created such an impact. And probably I would like to tell everybody that this is published in, I think, Lancet or in Nature, one of them, right? So which journal was this, sir?
I think Indian Journal of Ophthalmology. Was it in
No.
Indian?
No, I think this was one of the very high impact.
Lancet Global Health. Lancet.
Lancet. So basically, it was in one of the highest impact journals in the world, and with a topic which seems so simple, but it is such a high impact topic. The second thing, as you have said correctly, was about the methodology, because I think one example is we are actually writing a letter to editor for this, is that one study from the US has actually compared the femtosecond cataracts with a manual phacoemulsification, and they have done astigmatic keratotomies for astigmatism in the femtosecond cataract group with the femtosecond laser, but has not addressed the astigmatism in the phacoemulsification group, and actually has showcased in the results that the femtosecond laser shows a superior biometric outcomes, which is absolutely, of course, biased. So as you said, methodology is so important. And of course, the third thing, as you have said, is it is very important not only to prepare a study and present, but also to publish it. So basically, it is the natural progression from your presentation has to be towards publication. And probably I would like to also bring to notice of our presenters that from MOS, we have our own journal, which is the journal of JCOR. And this is basically on the way to get indexed. So I think after all your presentations, do make sure that you go and please publish your studies in the JCOR journal as well. I would like to invite comments from Dr. Bide sir and all the panelists also about the free paper presentation topic.
Yeah. Actually, Dr. Parikshit has given a great presentation and clarified all the doubts. He has gone stepwise. He's covered all the points which should be taken during presentation and what not to do and what to do. Of course, topic selection is individual's choice. But he has also mentioned about please select a topic which is pertinent to most of the ophthalmologists so that you have a higher chance of getting selected and going for the higher level, and maybe you may get the award. So all in all, great inputs from Dr. Parikshit as always. And as he has said, he has already represented 10 times in Colonel Rangachari finals. So maybe best wishes to you next year for winning Colonel Rangachari. And best wishes to all the presenters who will be presenting during MOSCON. So over to you, Dr. Vardhan.
Thank you, sir. Any other comments from any of our esteemed panelists? Dr. Mandar sir, Dr. Anaga, Dr. Deepak, Akshay, if anybody, Dr. Motevar, anybody would like to comment on the free paper thing, if there is anything you would like to add?
I think I'll wait for the other two presentations before.
Okay, sure. So I think Dr. Deepak wants to add something.
So it was a wonderful presentation from Dr. Parikshit, as always, all the details. A few practical tips I would like to share for all the people who are present, the young people. I think Parikshit has re-emphasized the value of time. There is no point. I think the key here is to be very well prepared. You should not prepare for 6 minutes. You should prepare for 5 minutes, 54 seconds. By heart it many times. You should not read all the words in the slide. You have to choose what is required so that it has to be like, a by-hearted presentation. It's not like you're going to search for words. A slide has maybe 30 words. You have to select and speak about maybe 8 words in that. So you have to be so well prepared. Most common mistake what people do is they put video inside the slide and they'll be struggling. The video is not playing, and you are showing a surgical paper is there. You want to show a surgical technique in a paper. It's a highly competitive era, and you can't say that because my video is not playing, you'll be looking here, there, somebody to help you out, and most students lose their marks during that part only. So you fix that issue first. So if at all the highlight of your paper is the video, then my recommendation is don't put it inside the computer. You should be able to bring it out immediately and then show it out, because you can't miss the highlight of your paper. Rather than showing the sex ratio and the age ratio, demographic data, which is of no consequence of the paper, try to save your time and try to show the highlight of your paper rather than struggling to, it is not playing. And what happens when the flow is gone, you will be out of your ideas, and a very good paper, good thought will actually lose the race here. So it's common mistakes which we did. And if you're usually presenting only on surgical technique and you want paper on that, best would be to make the entire 5 minutes, 55 seconds as a video only, and you should start speaking so that you don't waste any time. If your paper is not on surgery, then maybe you can choose clinical photographs and choose, you have to rehearse orally. Otherwise, make it a 5 minute, 55 seconds video, and you should practice speaking when the video is running. You can prepare a movie with all the graphs, even your written notes, everything as a movie itself, so that you don't lose your points on improper presentation. This is one common area where most students struggle here.
Great inputs, Dr. Deepak, and very practical.
One more last. Yeah. Because what happens, when you start your presentation, you wait for the judges to look up towards you, because what happens, they'll be marking the previous paper. By the time they look up, what happens, you already threw 4 slides.
Yes.
You already threw 4 slides, and then they don't know what you're talking about. Your introduction is gone, your aim is gone, and they start the presentation only in materials and methods. They'll have no clue on what your title was. So wait, don't worry, just wait there. You said you're not going to start the presentation until all the 4 judges raise their thing. They have kept the pen there. Now you should start. Otherwise, what happens? Because these are all things.
It's a very important thing. Yeah.
See, I have done this for the last 20 years. This all used to happen for first 5-6 years of my life. It is like this only. Before they open their eyes and see what is happening, I would have gone to materials and methods. They would have lost the important point. So don't do anything. Just wait. And they would have been, their head is already too much, involved. They are involved in so many other papers. They have to go somewhere else. So just wait to grab the attention of the judges. Then only you start. Another small tip.
Last point, I'd say that, like Dr. Megur said, see, everything is not under your control. The judges may be marking the previous paper score. They may have put up your slide, but the presenter there has already started the time countdown. Be a little fearless. When the judges look up, say, can I have the time reset? I'm starting now. Yes. Get your full 6 minutes value. Don't start at 5:40, because I know everybody has rehearsed second to second, minute to minute. And if you see that you've already lost 20 seconds, you start panicking and your presentation goes out of flow. So demand for your 6 minutes. No judge is going to say, no, your time has started. They will give you 6 minutes.
Just
Nice.
one question I have in mind.
Yes, sir.
Whether we can show the video clips during material and methods.
Of course, we can, sir. Why not? You have a separate video. You make this, minimize this, and you show the video. That 6 minutes is ours to show, as Dr. Deepak and Dr. Akshay said. We can use it as we want.
Okay. Thank you. Excellent presentation. Thank you.
I've seen Deepak's presentations and he starts with video and entire for 8 minutes, 6 minutes, his video is running and he's talking. So whatever he has said, he does that and in a very fantastic manner.
I think that is a great tip actually, because if they
Yes.
convert the presentation into a video, so they're time bound, of course. So if the time doesn't run out, they know where.
Parikshit, one more question I have in mind. How you apply biostatistics and other things at the end, or how you prepare all those things?
So that is done when we are doing the study. So when we are presenting the results, the p-values or the significant values, you write there only, like we had written in our test for the deep leper study or the low vision aid study. So you don't keep a separate slide for it. Anytime you make a statement, you write the statistical value after that only. But all of that is to be done with the biostatistician initially, before the PPT is made.
So how we can connect with the biostatistician? Is any authorized person is there, or you have
So there are many. I'll share you a few names.
Okay. Thank you.
Great. Thank you, sir. And I think it was a very productive talk and a lot of discussion. Thank you so much, Dr. Gupte, sir, and for all the inputs, Dr. Deepak, Akshay, and also Dr. Agarwal, sir. So I think we will move on to the next talk. And this is going to be how to make a winning poster. And for that, we have our own Dr. Akshay Nair. Akshay is the oculoplasty and ocular oncology head at the Dr. Agarwal Eye Hospital chain in Mumbai. He has more than 150 peer-reviewed publications. He has been a great researcher, and I've seen his keen interest in research right from his very early days when we were together in Shankar Nethralaya. Akshay had joined just a couple of years after me, and I was always intrigued with a lot of research-based curiosity that he had, and he was very productive even in his postgraduate days. He has been a finalist 2 times at the AIOC Colonel Rangachari session, which is amazing. He has won multiple best paper awards, including at AIOC for oncology, pathology, neuroophthalmology session in 2011 as well. He has had oculoplasty. He has won Oculoplasty Association of India Best Paper Award in 2015 and 2018. He has also won Best Paper Award at the Ocular Trauma Society meeting in 2018. And most importantly, he has won the Best Poster Award at the American Academy of Ophthalmology 2 times, which is 2013 and 2018. He has been included in the top 2% of the most cited researchers globally in ophthalmology by Stanford University ranking as well. So we are very happy to have you, Akshay, with us for this webinar, and over to you for your amazing presentation. Thank you.
Thank you so much, Vardhaman. So I'm focusing on 2 things. One is a poster as well as the photo essay. So I think when we talk about designing a scientific poster for the past 5-6 years, most conferences have moved away from physical posters to e-posters. But a lot of conferences, including the Maharashtra Ophthalmic Society annual meeting, the AIOC, as well as larger conferences like ESCRS and ARVO, still have hung on to the physical posters, at least for the top rated posters that qualify as posters. So the first thing to understand is, and I think I'm going to be overlapping a lot of points that Dr. Gupte sir has said, that remember the impact of a poster is no less than that of an oral paper presentation. It's that just the mode of conveying data is slightly different. And at the end of the day, the number of people who will pass by your poster is far more than the number of people who will be sitting in a session listening to a free paper. But at the same time, remember that your poster is not a manuscript. So it does not need to have every little word that a manuscript or even what a PowerPoint presentation of a paper presentation will have. And physical posters and e-posters are all moving away more from lines and lines and paragraphs and columns of data to more graphics, images, such that in the first few seconds that you see a slide or an image or a poster, you're able to gravitate towards it simply because of the visual impact that it has. So first you need to understand who's your target audience. Now, if you're presenting a basic science data project with with high level of molecular genetics or something very, very basic, it will be in much more detail. Remember, try to find out who are the people who are going to be in your audience, if based on the conference you're attending. If it's an AIOS or a MOS or a BOA, which are large meetings, versus subspecialty meetings like a retinal or vitreoretinal society, oculoplastic association, uveitis, or strabismus or pediatric ophthalmology meeting, where your posters can be a little more in detail, giving the exact gist of what your presentation is. Because based on the level of understanding of the audience and the judges, you will be able to present your poster in that much detail. So if you add too much details and complicated writing terms, you're limiting the potential audience who will grasp the poster at first glance. But writing it in simple form with more images appeals to both experts and non-experts. The first thing you have to know is that check the guidelines on the website. Every organization, every conference will tell you how to present your poster. Now, these are general guidelines in terms of what is the size of the poster, because if it's a physical poster, they have a limitation in terms of the canvas size where you can pin up your poster. They will also give you general guidelines on color, fonts, logos, and other requirements. While these are suggestions, they are not hard and fast rules. Say, for example, if you have an institute who has all of us have seen certain large institutes like Shankar Nethralaya or LV Prasad or Narayan Nethralaya or AIMS have a particular format where their logo goes on top. There is a color theme. There is a fixed font. So it doesn't mean that they'll have to change the way to fit it, but these are suggestions. And like, say, for example, they'll tell you use large print or shade of color block letters when possible, a minimum size of 28. Don't use more than 600 words, which is recommended on the poster. Now, when they say don't use more than 600, doesn't mean you have to use 600. If you're able to convey the exact concept of your poster in 300 or 400, that's even better. And also, headings that you should use: purpose, methods, results, conclusions, and don't forget your references at the end. And always, the last point is to include your email address in your posters, because poster session where someone is going past is the main session where you'll be able to connect with colleagues who are interested in the same specialty or have similar cases, or with whom you can collaborate. And as a fellow or a resident or someone as a trainee, you want to interact with these people. They could be a potential a fellowship mentor later on going abroad, or something that can come up. Imagine you striking up with a discussion on a topic that you're presenting as a resident to the head of the department of a large institute who just walked past and saw your poster. The next time you go for that fellowship interview, he or she is going to remember that you presented that, all because your poster was attention grabbing enough to get them to look at that. So don't worry about the fine details and the fine print. The primary purpose of a poster is not to communicate every little bit of the research, which means, the details of the inclusion criteria, details of the exclusion criteria. Leave that for the manuscript when you can publish it later. The main purpose, like I mentioned, is to attract people's attention, to give a high level understanding of the connection between the catchy title and the actual results or the conclusions. It's to serve as a conversation starter so you can network, connect, share, and eventually collaborate for more. So let's start. So there are different templates available. It could be a vertical poster, a horizontal poster. Default templates are boring, because if you go online and just do a Google search, scientific poster template, you will get hundreds of templates, which are, the classical white and blue, the beige and green, very, very simple themes. So you need to be a little imaginative so that from a sea of white posters, your poster stands out. So the big headings that you want to look are: give a small brief background, address your research question. What was it that you addressed in this presentation? And again, like Dr. Gokte sir mentioned, don't forget to add methods, results, conclusions. Don't harp too much on the absolute details of the methods of, right down to whether how many members of the institutional review board agreed or whatever. Small things don't need to be mentioned. Give a high level understanding. Now, this was an interesting poster that came up. Now look at how they've twisted it around. This is from a poster on a University of Adelaide poster on a topical gel for biofilm associated respiratory tract infection, where they've now created, rather than an aerosol or a tablet or an intravenous infusion, a topical gel with biofilm for treating bacterial respiratory infections. So they've created a cartoon character that says illnesses causing bacteria can live inside human cells, protected from the immune system. They are resistant, but we've developed a new treatment that boosts the strength of antibiotics and destroys the bacteria. And this lady dressed up like a female James Bond. At the same meeting, the presenter actually wore the presenter, Dr. Catherine, our researcher, wore the white tuxedo and a bow like a James Bond. Even before the poster session began, people were taking notice of who she was and made the connection, especially those who walked by the poster, that, hey, this is the same person. Now imagine you're going past a poster like this. Why would you not stop by and see this? So don't fall in the typical graphs and posters. Now, the second half of the poster below, of course, that's what the scientific crux, the gist of the heart of the poster. But see the imaginative the graphics that they use to draw your attention to it. So, and there's no one to say that you can't do this. Absolutely, you should do it. Again, based on the preference of the organizers or the space that is available, you can either orient it vertically or horizontally. The background color should be light and should have clean lines with a crisp font. I prefer all capitals because in a poster, clearer the font, the legible the writing, the better it's seen to the eye, rather than having small letters on the post font. Now, most common mistake, and this is one of the, Vardhaman mentioned won a best poster. This was the poster that won me a best poster at the American Academy a few years ago. And it has one of the common mistakes that I'm pointing out. Writing your abstract again in your poster is the biggest mistake. And right next to my head on the poster, I have actually written the abstract. So that's half a column of space that I could have used for something else, but I've lost it. So don't reproduce your abstract in your paper. You're already covering all the heads of methods, results, conclusions, and your discussion. So no need of writing your abstract. Remember, your abstract was submitted and it already got you to a poster session. Less is more. While they may say less than 600 words, if you can do it in less than 500 or 400, even better. Use images, use graphs, use striking graphics or crisp images that draw the attention. Now, we spoke about this paper on the effectiveness of presbyopic glasses in tea workers in Assam. Imagine if this was the poster. You're walking past in an ophthalmology conference, bam, you see a tea worker sitting in an image of a tea worker in an ophthalmic conference. And that's the graphic. It shows you the location the study was taken, the population who was chosen, what they did, what was the intervention, and what was the outcome. Greater tea leaves collection, greater revenue. And you have a graph of all the other details. So if you're able to convey visually what was the crux of your study, you're already attracting the attention without having to focus too much on the finer details. And you can also include all of those details by adding a QR code there. Someone who's genuinely interested in knowing the research methodology, what was the inclusion criteria, they can scan the QR code where they can access the manuscript and go through the protocol of the study. So use and juxtapose the images wisely so that anybody who's passing by can catch the eye of that paper. What do you use to create these posters? Like I said, you can always download templates, then declutter all the text boxes and the graphics and use the background as a canvas on which you can build. On PowerPoint, using an A0 size of your slide, is usually typically what most large physical posters are in conferences. You can also use Canva, which is a free online software. Also, you can create your slide and then upsize the canvas size. It is always better than downsizing, because when you downsize, a lot of things get cramped. And if you're not comfortable with either of these, please reach out to a professional. Get professional help from a DTP expert who can do it for you. And if physical posters are being used, create the high resolution PDF and then share it with a printer. Preferred materials, and in India, printing is extremely cheap. So you should always carry it from here and go there. Printing a large 3x2 meter flex or a vinyl poster in a nice plastic or a cardboard container as a carry-on is far cheaper than paying $200 and printing it in the US or Europe, where things like this may be slightly higher quality, but you're using it only for 4 days at one conference. So think wisely before doing that. Excuse me. Finally, in a small line, don't forget financial disclosures, email addresses, and references. Remember, references are important, because if there is someone who's worked similarly in the past on a similar topic, and they see that, oh, he's presenting something similar to what I am, they will read it. They'll also glance to the references to see, hey, is my paper included? So make sure important, relevant references are always included at the bottom. You can always concise the references to add just the last name of the first author, et al., and just the journal citation. Even without the name of the paper, it will be enough. So I was just going through the scientific program of MOS, and we have e-posters as well as the physical posters for the top 20. Now I noticed that in the first 10 e-posters that I picked up at random, 7 of them are single case reports or case series of no more than 3 cases. So when we are talking of these things now, when we know that we are presenting a single case as an e-poster, we again need to transition to e-poster and see how do we come up with the construct of an e-poster. Now, the MOS guidelines says that it has to be 12 sides. The title of the paper should be on the title slide along with your poster number. Write the author's full name with affiliations and financial disclosures. Now, come take a step back. Before submitting a case as a e-poster or a poster submission, we need to ask ourselves, why are we choosing a single case and presenting it? Is a single case really that noteworthy that it should be presented, or are we just presenting for the sake of presenting? So your single case should be presented either as a paper, a poster, or any form, only if it is a unique manifestation of a known disease or an extremely rare disease, or you've used a new treatment modality to treat a common disease, or you've seen an unusual complication or an association between 2 common entities which was not previously known, or an atypical outcome or complication, or you can just use it's like a known disease, known condition, but here you're using multimodal investigation to document interesting new aspects of it, a known condition, but now you've done sham plug imaging, you've done OCT angio, you've done ICG in previously known conditions where this was not commonly done. Those things can be single case posters, something that stands out from the crowd. Now, look at the slide title. Do not overcrowd the slide. And this is all the details of what font you should use, what should be the number of lines, how many images should you put, what is the quality of images. Now, if this was to be a slide in your e-poster, I can guarantee you that forget a judge, even a delegate will not spend more than 5 seconds on this. Now, the same thing can be conveyed in this form. E-poster guidelines, your size, the image details, the spacing of your text, the font size, title slide inclusions, and what should be excluded from a poster. Now, this conveys the same thing that this is supposed to convey, but retaining the attention of the viewer or the judge. So try to keep less in more space, less information, less words, more visuals, more graphics, but relevant graphics. Just for the sake of it, don't include anything. And like Dr. Gokte sir said, even in an e-poster, you have to give a certain amount of respect to the intelligence or the intellect of the viewer. You don't have to write full sentences. Bullet points will convey to the viewer what you're trying to say. Just like you don't have to read every word on a poster, you don't have to write every word you mean on a poster as well. Now, slide layout, very, very brief. This is from one of the papers that we presented. It's tells you the sex ratio, the mean age, and the most common presenting complaint quickly without harboring too much on the point. Now, similarly, when you come to discussion, I included this slide because you can either have it two ways. You can have all the references included in a single slide at the end, or as you go, if you're citing a particular paper, make sure you include the reference at the bottom of the paper or the slide. This is even for e-posters and posters. And when you're summarizing, no more than 6-7 bullet points. And like I said, you don't have to spell out every word. When we're talking about systemic malignancies and metastasis, poor prognosis is associated with significant shorter survival time. Later presentation with metastasis means more metastatic sites involved. So anyone who's interested in the topic would read it and get the gist of it. Again, less is more. And common mistakes, not doing a detailed review of literature. Like like Sir said, not knowing whether this has been documented or researched previously is the biggest mistake you can do. Not discussing your own case in detail or overlooking important details, and not highlighting why your case is different or what was it that you did differently in this case is important. Now, if this was the title, I've obviously changed the names and the details here. But if this was the title stage of a slide, I would not be interested in going forward. The number of typos, the typing of it, you don't need to add who's a junior resident, who's a professor, who's a head in your title slide. Just the names and the affiliation, along with the crisp title, but make sure that your spellings are correct, your capitalization is correct, because this tells you that the person who's presenting actually took the detail to dot the I's and cross the T's and paid attention to small details in making the slide. Whereas if the first slide is so careless, I'm not even interested in going ahead. And now coming to photo essays, when would you submit a photo essay? Essays should not be just because you saw a case and you had a phone in hand, you clicked an image, you want to send it. It should be something unusual, something striking. Like I said, submitting new image modalities with catchy titles and always describe with a story. And now of course, technology is in the palms of our hand. So I'm going to give a cheat code that you can use. So this was a case of a Merkel cell carcinoma, an extremely rare case. Only the third documented case in the Indian subcontinent, which we operated, was published in IGO. This image came on the cover of IGO. And now, if I were to use this as my submission for a conference, and I'm running out of ideas, there is a friend you can always lean on to get an idea of what you need to write. You shouldn't copy paste, but getting an idea is always good. I have an image of an eyelid tumor. It's a Merkel cell carcinoma, an extremely rare vascular tumor. I'm submitting a high resolution image of this tumor in a photo essay for a scientific journal. Can you suggest a few catchy, witty, original titles for this and briefly describe in no more than 100 words about this eyelid tumor seen in a 43-year-old female? And of course, our dear friend ChatGPT does a lot of this. So I don't want every resident to log on to ChatGPT and do the work, but this is something that, can help you or give you the nudge that you need. So to summarize, follow the guidelines, but be imaginative. Communicate as much as possible in as few words as possible. And remember, graphics, images speak much more than the words in your sentences. It is important to catch the attention of the viewer. Don't forget to add your email address and a QR code where someone can access details of your presentation. And always before submitting, have colleagues or teachers go over the presentation or the abstract for corrections and suggestions. And I think we can also have a suggestion from my end is that MOS can also send out an email as, once AIOS abstracts are accepted, that if there are PGs or fellows from Maharashtra who are submitting, presenting at AIOC, we could create a grooming committee where they can present their presentations beforehand. We can suggest changes that they can make to their presentations, to their presentation style, and we can fine-tune them, increasing the chances of them winning awards and going to the Rangachari session. Thank you.
Very good suggestion. Excellent suggestion, Akshay.
Yeah, very nice.
In fact, that's what we have done for Teachers of Tomorrow session.
Yeah. Yes. Yeah, very nice. Very nicely covered, Akshay. Absolutely. I think both the e-poster, physical poster, and photo essays. And I think some of the examples that you have shown were very pertinent. And I think one of the most important point that you have tried to make and which is important is that the poster is no less than a paper. And in fact, we always see that, which was also rightly pointed out, that actually there will be more visibility of a poster than a paper. So do not get disheartened if somebody's paper was actually either rejected as a paper and converted to a poster, or it was selected only as a poster. It is still a great way to present your study. And in some of the greatest conferences in the world, meetings in the world like Arvo, it is 100% or almost
IAPB. The poster is considered better.
So I would like to invite any comments from the speakers or panelists about the same, about the poster. If there is anything that you would like to add. Aditi, you want to add something?
No, it was a super presentation. The right point I would again like to emphasize, because we got many emails telling that we have sent this as a free paper and got selected as a e-poster.
Yes.
So actually you are going to get a better visibility than just presenting in a hall which may or may not have more number of audience, and this is just one time thing, whereas poster will have visibility for all 3 days. So take it as a positive thing and go ahead, because there is a lot of things which you can do with a poster, either e-poster or a physical poster. Yes.
And I think Akshay has shared so many ideas how to create poster. In fact, he has demonstrated in fact, he has in next 2 slides only he has shown how you can present in a better fashion. Great.
Absolutely. Great. So if
excellent presentation, huh?
Yeah, very good.
I think that definitely it's going to be very, very useful to all of the viewers. Very nice.
And he has given a very good suggestion that we should groom our students who are going to present in all India. In fact, we are doing that. So Vardhaman will definitely continue next year also.
Yes, sure, sir. Yes, a great suggestion, as you said. Yes, absolutely. All right. So I think now we will move on to the very important last talk, which is one of the most exciting ways to present your work, is in the form of the video session. So video presentation is, of course, a very visual way of presenting your work and has a great way to showcase if you are dealing with unique surgical scenarios and new innovations. And I think large amount of very innovative work can be showcased. But it is very important, especially in video, that the way you make your video, the way you edit your video, the way you present your video is extremely crucial. And I think there is probably no better person then, of course, Dr. Deepak Magur, who is going to take us through this. We all know Dr. Deepak is a great teacher. I think his YouTube channel has one of the highest subscriber base in the world, and he has taught through his videos so many young ophthalmologists and seniors as well. Everybody keeps learning from him all the time. Dr. Deepak is currently heading the cataract and glaucoma department at the Magur Eye Hospital at Bidar, Karnataka. He specializes in complex cataract surgeries and is passionate about teaching, as we have all seen through his both YouTube channel as well as the website. He has series of very prestigious awards that he has won, including the ASCRS 2023 Best Video Award, Vidarbha Ophthalmic Society's Lifetime Achievement Award, the highest video presentation award from AIOC, which is the CS Reshmi Award in 2020. He has also won multiple Best Paper awards in AIOC, also in Karnataka Ophthalmological Society, as well as the Asia Pacific Ophthalmological Society, Glaucoma Ophthalmological Society as well. And he has basically a great passion to even teach people about video making skills, video recording skills, and video presentation skills. So we are very lucky, very fortunate to have Dr. Deepak with us, who is going to take us through how to prepare and present a best winning video. Yes. Over to you, Dr. Deepak. Thank you.
Thank you for the opportunity, Dr. Vardhaman and all the office bearers of the Maharashtra Ophthalmic Society. I think Maharashtra Ophthalmic Society has been probably the most active state ophthalmic society in the last year. Kudos to you for doing such a wonderful job. I myself have attended many of your sessions, so I can understand how active you have been in communicating the scientific knowledge. So congratulations and keep it up. I also learned a trick from Dr. Nair. Just said that you can train on MOS students when you're presenting in national conferences. So I'll carry this message to our Karnataka Ophthalmic Society. Thank you for the tip, Akshay. So moving on to the award-winning videos, how to create one. Well, obviously, we can say there are so many methodologies and there are secrets. We always believe that are there any some secret? So, well, obviously, the biggest secret is luck. Okay, I cannot re-emphasize this because you definitely require luck in any of these competitions, be it the best paper or the e-posters or video. You can't undermine this factor. Apart from this, what best we can prepare? I think the previous two speakers have shared with you all, and let me take you through the video aspect of it. But one can't, I can't re-emphasize the rate of luck. So whenever if you don't win an award, don't be disheartened. So it's always helps us at least you have been involved in a little bit of a creative thinking, both academically or even artistically. So that itself should be motive or an inspiration to do a better time for the next conference. So obviously, most of us would have been feeling very unlucky. We have lost many number of awards before winning them. So failure is a stepping stone to eventually achieve the awards. So the first important thing would be to understand the film judging criteria, which is usually uniform, but each of the conferences have a different way to analyze things. So let me just take you through this one, which is by the ACRS. This is usually the standard which is followed by most ophthalmic societies worldwide. Obviously, the greatest thing would be the first information which is required is the educational value. What educational value does this film give us? Originality, that obviously is a consideration point because this is a scientific event and you have to ensure that the contents are scientific, which are relevant to practice. These are the three which are probably similar to your free paper or poster. The fourth and fifth point are related to especially the video part of it, because this is a visual medium. So a lot of emphasis is given on the cinematic quality, whether the technical aspect like audio, the video quality, editing aspect is good or not, and the artistic effects. How have you managed to incorporate the background score? Have you made it used enough animation to make it attractive enough to engage the audience? So these two are exclusive to your video aspect of it, but the first three are the same. So, the relevance to the practice, the originality, and also the scientific content. This is what exactly stated in the ACRS. Now, of course, each competition, there's always different styles are preferred. Suppose if you go to the ASRC, that is the American Society of Retinal Surgeons, they have a session where the fun element is in the videos is probably more appreciated, whereas the AAO and the ESCRS, they prefer probably more serious stuff. So you have to be aware a little bit about these aspects. And among all the awards which you have, the most difficult one is the CS Rishmi Award to win. It is probably the most difficult because you have to go to multiple filters to reach the finals there. And because it's a multi-speciality, films will be competing. It's not like one specialty. You'll be competing with an orbit person, you'll be competing with a refractive surgeon, a cataract surgeon, a retina surgeon. Everything is mixed. And the judges will need, and each judge will find a different way to address, because some of them would be cataract surgeons, some of them would be retinal surgeon, and what fascinates them will be very, very different. So that is the reason I tell, this CS Reshmi Award is probably the most difficult one. So your film really has to be outstanding in all aspects and convey the message in a very simple way, which can be understood by most specialists. Then you're more likely to win. The chances of winning awards in the international festivals is much more easier because there are multiple sections in the same specialty. So compared to winning our AIOC award, other awards are significantly easier. Although the competition is much more wider, you have representation from different countries, but still, I think that's a fair ground to, if you're fair ground to compete, because the judges are uniform and you don't have other specialities to compete with. So a little bit uniformity is there. So it's much more easier to win those compared to this. Only thing is your content has to be good of international standard. That is one thing. Otherwise here, because so many complexities are there, there's a reason I feel the winning the CS Reshmi Award is probably the most challenging one. So let us try to dissect out and understand what are the typical characters of an award-winning film. So as is evident in a scientific paper or a poster, you have to be very strong in core message. Like Parikshit sir said that, ultimately your paper has to, at the end of 6 minutes, it have a clear takeaway message. If it is unique, if it is new, then definitely there's an advantage. But at least when you're composing your paper or a video, you have to have a very strong core message. Well, the most higher points you get is if your core message also has something which is very new, which many people are not practicing or not aware, then probably this is your best bet to win an award. The third would be a technical aspect of it, the quality of the film. This is also important, but not the most important thing, but it has to be of certain decent value. Because what happens, you may have the best idea, the most newest idea, but the quality of presentation is poor, then you lose out the chance. So at least it has to be average or above average, the quality of the film. This may not be the most important ingredient of the film, but it has to be at least decent enough. You don't have to have the most sharpest video, you don't have to have the most clearest audio in that, but it has to be acceptable. That should be the message. But if you have the best quality of the film, but the message and the novelty factor is not there, obviously you're not going to win it. Nobody is going to give an award just for an exceptional clarity. But if whatever the subject you're presenting is mundane, old, and it has been told many a times, this has no value. This has got only value when the first 2 points are interesting. Then obviously, this again is a technical aspect. You have a message, you have something new to offer to the audience, but the way you tell the story also has to be interesting and engaging. You can't bore them to death. So these are 8-minute videos which you have. So you have to be intelligent enough to ensure that you don't lose the attention of the audience during these 8 minutes. The judges or the audience, you have to ensure that you have to build a film in such a way that if you are an audience, whether you find it interesting or not. So first put yourself as an audience or a judge, and then imagine how you would want to see that film. So the storytelling becomes an important aspect of it. You can't bore them in any aspect of the film. You can't be repetitive, telling the same thing again and again. And also try to edit out all the unnecessary things. So how to begin? The first thing always to begin, which is probably the most important critical thing, is to write the script. You can't just take a video and sit and edit and all those things. The first, it is like, you want to tell a story. For that, you have to write a script. You have to have an opening part, you have to have a middle part, and you have to have a climax part. You have to literally write down the script. Then you should shoot, or if you already have videos, then compose all the clips. And then editing. What does editing mean? Choose the right clip for the right dialogue which you're writing. It is not like first you arrange the film and then dialogue. First, write down the script, everything, what you want to convey. Then your film clips should match what you want to tell. So search for the clips, what you want to tell, and then add in between. So the message here, you should have a large bank of video clips. From then, you have to choose the clips and then put it in your timeline from what you want to tell. So that is how the process has to be. The first thing to begin with always, when you write a script, okay, you have an idea. You have an idea, like you want to make a film on this or you want to write a paper. First thing always is you should be able to tell the synopsis of the film which you're making, which is 8 minutes, in 1 minute. Okay, you should be able to convince your friend or a peer or an audience, what is this film about? You should be able to convey the message in 1 minute. Okay, my film is about this. In 1 minute, you should be telling. So if you have a clear beginning and end, and if you're able to convey the clear message in 1 minute, then you know you're right with the synopsis. Then you start to build a script. You're writing the script is like, what is the starting point, what is the ending point, and what is your climax part. So first begin with the synopsis. Your film, what is the message in this film here? You should be able to tell in one minute. Then you build this to an 8-minute film. So you have to work your script around this one main goal. So by the end of the film, which is usually 8 minutes in most competitions, you should be able to convince the viewer about the goal which you intended to achieve. Have you achieved it or not? So typically most films, any film, we have a 3-act setup. Like, this is for a drama or a novel or a film. Any story, it has a 3-act setup. So this is how it is built actually. So first you have a main plot point, that is a setup. You have understood the situation. Now there is a problem with the situation. You identified that problem, okay? Then in the second part, you are going to explain to them what is this problem about, and what are difficulties which are typically faced, and what are the solutions which have been explored in the past, and what is the solution you are presenting now, and what difficulties are you going to expect. Then in this part, you're going to also tell what are the difficulties you're expecting and how are you plan to solve them. This is the hypothesis. Then lastly, the problem which you have created, how are you going to resolve it? That's the resolution. So then you are going to share how you have implemented your hypothesis and how it has worked well for you. It's all done using video clips itself. And finally, you have to show the climax because the change of the technique, whatever I have done, this is how the problem has been resolved and this is the solution. So you have to build the film in a setup, then second is the confrontation, and third would be the resolution of the problem. So most common mistakes while developing a script is that beating around the bush. So you don't have to beat around the bush. You waste a lot of time. Time is invaluable and priceless. You have to be, as I think Dr. Nair was telling here, you have to be as minimalistic, is using as less words as possible, but to convey the maximum amount of message in that. Because we have only 8 minutes to tell the story here. So minimize backstories, be precise, and be to the point. Just for example, if you're making a video on strategies to minimize Rex's runoff in intumescent cataract, okay? So don't waste time on introducing the different types of mature cataracts, classification of mature cataracts. What is an intumescent cataract? You assume that these people know intumescent cataract, start from there itself. It's just an example. Don't beat around the bush. Immediately you should start. The intumescent cataracts are a basic problem of an raised intracapsular pressure. And these are the strategies which have been used. So don't waste time on all those things because you expect the audience to be reasonably educated among all these things. And avoid unnecessary subplots. Now imagine the film is about the same thing in intumescent cataracts. Avoid getting into not so important territories. Like don't waste time on, say, management strategies of Morgagnian cataract. You say there's another variant of mature cataract is a Morgagnian cataract. It is not relevant at all. Don't waste your time on these unnecessary subplots. So when you actually write a script and start editing, you realize that your film has turned out to be 12 minutes. So then you have to sit and identify very brutally that, this is not relevant, this is not relevant, you have to cut it down. This is what happens. So when you make a film, it actually turns out to be 12 minutes or 15 minutes. Then as a filmmaker or a surgeon, you're very passionate. I want to keep all these parts because it's very dear to me. But as an editor, you have to be very brutal. And you have to think that, are we able to, tell the exact story which we intended in this 8 minutes or no? So you should be very brutal in editing out all which is unnecessary. Just keep the clips or the story points which are relevant to this plot which you have started, and is it conveying the message? So that is what you have to be very brutal and very honest in that, because time is critical. So always maintain a razor sharp focus on the core issue, whatever you're trying to be. You don't get to be digressed. So don't want to have many subplots. You may be more knowledgeable about many things, try to squeeze in too many things, but try to keep it as simple as possible for the judges and the audience. So always one tip here would be, don't try to delve into too many topics in a single paper or a single video. So try to be very focused on one particular outcome for a one particular problem and stick to that. So, when okay, now the script is ready and you have whatever thoughts in you, then again, you have to divide the video into three important parts. The first is the introduction part. The introduction part is like, your Bollywood film, the hero introduction is the best footage which is already kept. So you have to identify the best footage of your entire clips library which you have, identify the most impactful footage of it, and try to use it in an introduction part. Because when the audience start to see, immediately your goal is to grab their eyeballs, and you have to keep them hooked. So that is the reason why you have to choose the best footage, and which has to be very highly impactful. That has to be your intro scene. So this is just like how you're introducing your hero. You have to, a lot of build-up is there and all that. That is the reason why you have to keep the best footage for the introduction scene, where you're introducing the problem. What is the problem which most people encounter? So this has to be you have to choose the best footage among the library which you have. Next would be the body of the film. Here, the second part of the film, where you are going to be diving in detail about what are the typical problems which you encounter while trying to solve this issue. And you have to be, try to have the case series. So once you identified a problem, then you say, this is the way to manage this. This is what your hypothesis is there. And then you are going to showcase your case series. Say maybe your 10 cases, 15 cases, short clips, whatever innovation you have done in that part, and whether it works or not. Then you have to show these case series. You can't show just one case and be in a competitive session. It's ideal to have at least few more cases in a series, so that it is convincing enough for the judges to know that whatever technique you're presenting is reproducible in large number of cases. So that is one thing. So it ideally helps you to have more number of cases. This is the part where your details of your study or technique or whatever you're going to highlight a little bit, and also show a little bit more number of case series. Usually just showing one case does not attract much of an attention. And again, lastly, the climax shot. This is where you have implemented your technique, and this is how the things have turned out. The last 2 minutes has to be, again, you should choose the best footage. And this has to be highly impactful, because the judges or the audience, when the film ends, they should be going on with the memories of the best part of the film. And the climax or the take-home message, we should be very strong, with strong visual footage to keep them. They shouldn't be able to forget this film for the next at least an hour or so. That should be the goal when you write like this. So try to choose the best possible footage, best possible dialogues which you can write, so ensure that it carries a highly impactful thing. So for this, you should have a large number of cases. Keep them in your library. This will help you to choose the most well-photographed ones. Because of course, it's a visual medium. It has to be impressive. So it helps to have a large file of your cases. So this can be only done if you record every case of yours. The complications don't happen. They don't tell and happen. So unless and until you record each and every case, you don't have a large number of cases for you to make a study out of it. And always when you're recording, if you're very eager to do well in these competitions, try to record in the best possible quality in every case. That is one message. Then among this library which you have to choose the most relevant clips to add on to the film. And lastly, documentation is extremely important. That shows shows how transparent you are and how reliable your study is. That is the reason why you have to document the pre-operative pictures and videos and post-operative pictures and videos. These definitely have much more impact on the audience and the judges. And you have to put in a lot of effort to collect this data at your center, making an effort to collect the pre-operative pictures, post-operative pictures. This will make it more relevant, more believable. That's the reason why documentation is absolutely critical. And always, you have to ensure that have a couple of hero shots. hero shots. Those are the shots in the film, or the small clips which the judges always remember. They are the highlight of the film. Just like, for example, I'm telling you, this is the film shot from Bahubali. I think see, this is the mother holding the baby. She's drowning and she's holding it. This is a very imaginative shot, and most of us who have seen the film will not forget this shot for long. So you have something very imaginative, or which is very well come in your video, and use it at the beginning or the end, and that shot has to be, carry the core message. So you have to search and find a hero shot. We call it a hero shot. The people should remember this shot for long. So something like that. Now, in my film, I had showed a case of spontaneous rupture of poster capsule, which is happening, which is the film title When Less Is More, which had won the CS Reshmi Award. So you are just showing something which is very unique, which is not seen by many people. And that thing, you have to believe that this is something unique and try to capture in the best possible thing and to show them. So always have one hero shot in that. Now, coming to the audio part of it, the quality of recording of audio is probably more important than the video. Even the video is good, and the way your audio sounds is not good, then your whole purpose of the audio videos gets messed up. Remember, ultimately, it's a type of storytelling. And storytelling, although the film is a visual form, the communication of message always is backed up by your voiceover. So what most common mistake which I have seen being a judge as well is that you use a lot of background music which is hovering around, which is so loud that the voiceover is not heard at all. So don't use it just as anything. It has to be used to convey an emotion, but should never be a distraction. So most of the time, the background music is so loud, so jarry, and sometimes it doesn't gel with the scene which you're using. And most often than not, what I have seen is the voiceover volume is very less and the background score is very high. So that shouldn't be a thing. So voice always has to be very clear. It has to be, you don't have to have a particular accent or anything. It has to be very clear and crisp and understandable by most people. And don't use the background sound which can be distraction. And before submitting, always ensure that it plays in different other computers. Check the video resolution, because when you render the movie, many times what happens, rendering happens in a lower resolution. So always check it, probably play it in your TV or something and see whether the resolution is good enough or not. Check the audio, all the part of it, and of course the compatibility. Some of the conferences want it to be in a particular format. Ensure that it is in that format. Show it to a couple of your peers, colleagues, and then send it. So before sending, that should be it. So that's all from my side, and wishing all the people all the best. And it's all about learning. We all keep learning. That should be it. Thank you so much for your attention.
Thank you so much, Dr. Deepak. I think this was amazing and super comprehensive. I think this is something that we have never actually seen with this comprehensive kind of manner in which you have tried to teach this. And I think some of the very important points which I gathered from here is basically people always think about that quality of video, animation, and all those things. But I think one of the important crux that you have mentioned is the quality of your study is very important, because if your quality of the material is not good, only the quality of video is not going to sell you through. And the second thing is the importance to be given to the audio. So I think that is again something that is very crucial. So I would like to invite also comments from Dr. Bide sir and all the panelists also.
Yeah. Another most important tip was that use more than one case to showcase during video. In fact, I have one question for Dr. Deepak. What software you use for editing your videos?
So I am using the Final Cut Pro in the Apple MacBook Pro, and also the DaVinci Resolve. DaVinci Resolve is another software which is compatible both with Windows and Mac. That also we can use. I think you have to be, any software will do so. That's not an important. The software people waste a lot of time on thinking about the technical. You stick to one software, learn everything about it, and then you can proceed. Okay, that it's not such a difficult thing. You have to, of course, you require some time to do it. This is all done by you. You have to sit and do it yourself. You can't get it done by somebody else.
Clipchamp, which is available with Microsoft. Is it good? Clipchamp.
Which one, sir?
Clipchamp.
Clipchamp, I'm not sure, sir. I have not heard about it.
Microsoft it is.
Okay, I'm not sure. I think maybe you better to have a paid software which is a little bit more professional, and you may require a slightly performance oriented computer. It is worthwhile investing if you're interested in making videos. And these are some things which we have to learn, and then maybe teach our staff to help you out with this edits and all those things. There's no escape over it. You have to learn on your own. And nowadays, YouTube is there and internet is there. I learned everything from YouTube only. How to operate these editing softwares and all. So everything is available. It's education is free, literally. So I learned everything from internet and YouTube only. How to use these softwares and everything. It's all there. First thing is, if you have interest, you'll find your own ways. Don't bother so much about what software and those they don't think. The first thing is start recording every case. That is the first thing. Once you record, when you have data, then you have so many ideas which come to you. Once you start seeing your own videos day in and day out, then definitely you'll come to know what mistakes you only have done. How do I rectify that? So starting point is record your videos. Then you'll get all the answers and so many material to.
Excellent presentation. Dr. Deepak, I have one question. Many people show their data on video, means just like a free paper. So can we show our data? What are the results? And
yes, sir. Yes, it's absolutely fine. So I told you, even for free papers, if I am presenting a free paper, usually I'll do it in a video format only. And all your PowerPoint, your graphics, everything can be converted into a movie form and added into your movie itself. So your graphs and written PowerPoint slides, text material, everything can be done in a video itself. It's not, it can be done also.
And is it compulsory to have voiceover, or can we present?
For all competitive sessions, you have to have a voiceover. Otherwise, they're not acceptable. They don't accept it all. It's mandatory.
Okay.
Yes, Dr. Mandar.
I think in MOSCON conference, we generally don't have voiceover in video session.
Sir, we ask them to present because in MOSCON, present with their own, they present in person. In person, in real time.
Okay, I was not aware of this. Sorry, I'm not aware of this. So in our state conferences, our state and AIOC, the strict is you have to have a voiceover.
Voiceover, yeah. So when they submit with a voiceover, actually, for their selection in MOSCON also.
Okay.
But when the sessions are conducted for their, let's say, to choose the best, then that time they have to speak on their own.
Okay. So this I was not aware. I think this is unique.
I think Dr. Mandar sir wanted to probably make a point here.
First of all, I want to congratulate the Scientific Committee of MOS for conducting and holding this very unique webinar, which will be very beneficial to majority of the people who are eager to present various kind of presentations like free papers, etc. Congratulations to the three speakers who have put in a lot of efforts in making their point across. I want to sum up the whole thing with 3 C's. One is curiosity, the second is concept, and third is collaboration. I'll just briefly elaborate on the 3 C's. The whole story starts with curiosity. Research starts with curiosity. So there is a question in your mind, and that's how you start exploring, and then you start working backwards or forwards in the context that you are doing this study. And I think that is something which all of us need to have as clinicians. The second is, of course, the whole concept itself. How are you going to approach that particular study? Whether it is going to be a publication or whether it is going to be a conference presentation, what kind of conference presentation, etc., etc. So that also needs to be kept in mind. And I think the third most important is collaboration. So when we are working, we are often working solo as practitioners. But I think research is a collaborative effort. So we need to take help from our colleagues, from seniors, from our juniors, maybe even residents working in the departments. Because if that collaboration develops, then only meaningful research is presented in the conference. And I think Maharashtra Ophthalmic Society, I have been the Secretary of Scientific Committee a few years ago. It has definitely improved by leaps and bounds. There has been a lot of emphasis on the quality of free papers, posters, and videos that have been accepted, and a system was put in place whereby there was screening for the submissions, and that has been followed subsequently. And I think that is extremely important, because you may get maybe 500 submissions, but all submissions are not suitable for acceptance for various reasons. And here I would like to make the last point that if your submission is rejected, don't be dejected, because that doesn't mean the end of the road. That's just a stepping stone, as Dr. Deepak had also said, that it's just a stepping stone. Maybe you can improve on your concept, improve on the project that you're working, and resubmit it, and probably you may get accepted and even win the awards. And the last and the final point I want to make is that awards are important. Definitely, you should aspire for it. There's absolutely no second thoughts about it. But I think the three clinician researchers who have presented their talks today, they did not present in conferences keeping awards in mind. That was an end product or byproduct of their work. And although everybody doesn't win an award, but I feel those who participate or submit or get accepted, I think they already are winners. So with that, I again thank MOS for giving me the opportunity to express my thoughts. Thank you.
Thank you, sir.
Thank you.
I would like to invite if there are any other panelists who wants to add to this discussion.
Yeah, Vardhaman, I was listening to all the talks.
Yes.
Fantastic idea of the MOS scientific committee team and you. This has come up. We last year with Dr. Ranjit Mania as the chairperson, we had done Colonel Rangachari and Colonel Reshmi award presenters to about 20 people. We tried to groom them. Of course, it was a closed door session, and on a similar concept, we have put it across to the whole of the scientific community. Fantastic way of doing it. All the three people have given fantastic tips. It has gone down very well with, I think, each and every postgraduate, and also even the consultants who are listening will have a lot of brownie points how to go about it. Fantastic. Very nicely done up.
Thank you, sir.
I'd just like to congratulate all the speakers as well as the scientific committee. Excellent, and very unique. And I think not just the students, but even the routine presenters also, everybody has got wonderful insight into all. Very well done. Thank you.
All the talks were inspirational, so everybody will start presenting. And
Yeah.
those who start presenting are all winners, actually.
Absolutely, sir.
Yeah.
Very nice presentation, Vardhaman. Congratulations for a nice Zoom meeting with a stalwarts, and it added some tips or pearls of wisdom to our knowledge also, and definitely our scientific community will improve further and further. Thank you so much.
Thank you very much, sir. Thank you so much. That was the whole purpose for our MOS presenters and the young ophthalmologists to gain pearls of wisdom from the experts and multiple award-winning presenters that we have, and we are very thankful to all of them. But for the official vote of thanks, I would like to invite Secretary Scientific Committee, Dr. Aditi, forward, please. Thank you.
Thank you, Vardhaman. I would like to thank our esteemed speakers, Dr. Parikshit Gopte sir, Dr. Akshay Nair, and Dr. Deepak Megur sir, for wonderful presentations, which I'm very sure all the presentations are going to be the guiding light for preparing presentations, not only for this MOSCON, but even for further state, national, as well as international conferences, because they've shared their wide experience of presenting different formats in different types of conferences. I would like to thank our panelists, Dr. Anagha Madam, Dr. Motevar sir, Dr. Santosh Agarwal sir, and Dr. Mandar Paranspe sir, as well as seniors like Dr. Taswala sir, who have interacted with us, given their inputs, and they have made the session more productive. I would like to thank Dr. Bide sir for being there, as always, like a guiding light and a rock solid support. I would like to thank Intod for the support and the technical team for a glitchless webinar. And last but not the least, I would actually thank all the MOSCON presenters and all other audience for joining. I'm sure this webinar will help in raising the quality of all presentation in this MOSCON as well as the further conferences. And obviously, thank you, Vardhaman, for the wonderful concept on which we actually did this. I am sure this will be very helpful for all people, and looking forward to seeing most of you during our state conference, and welcome to Kolhapur in few more days.
Yes.
Thank you so much, and thank you to Aditi for all her untiring efforts and all the help, not only for this webinar, but of course for
Throughout the year, actually,
humongous MOSCON program and throughout the year as well. And also, we would like to thank Ento team for their technical support for this webinar and also all the webinars that we have done throughout the year as well. Thank you very much.
Thank you. Thank you.
Thank
very
you.
much.
Bye.
Thank you.
See you at MOSCON soon.
Thank you, everyone. See you all.
MOSCON. Thank you.
Thank you.
Hello, good night, everybody.
Good night.
Fantastic job.
Yeah. So let's join another webinar.
Then another meeting.
Yeah.
Yeah.